Welcome to Raaonline. Today's topic is about pyrexia in pregnancy. So in this topic, we'll briefly discuss about the what are the causes of pyrexia in pregnancies, investigations and the management in a gross view. And also we'll talk in detail a little about dengue in pregnancy and asymptomatic bacteria. So we all know fetus is an integral part of the feto-maternal unit. So what happens is that when there is pyrexia during pregnancy, it affects the mother as well as the fetus adversely. That is why we should not take fever lethargically. We have to treat them actively, thereby preventing damages to the mother as well as to the baby. So what does RCOG defines maternal pyrexia as? A temperature of 38 degrees Celsius, one recording, or if it is 37.5 degrees Celsius on two occasions, 2 hours apart. Either it is 38 degrees Celsius or it is a 37.5 on two occasions, 2 hours apart. So what are the physiological considerations we have to keep in mind is, as such, pregnancy is a anabolic state and also the BMR in pregnancy is increased by 30%, thereby creating more heat. The temperature of the pregnant woman usually sometimes it raises up to 37.8 degrees Celsius because of the increasing BMR, and thereby the heat production also increases in pregnancy. And also we have cutaneous vasodilation. There's around 300 ml of blood flow, increased blood flow to the skin alone, to the cutaneous regions. So thereby the heat, the body temperature also rises in pregnancy. Why severity increases in pregnancy? Why the severity of infections and fever, everything increases in pregnancy? It's because there's decrease in cell-mediated immunity. We all know the immunological adaptation in pregnancy is that there is a shift over from Th1 to Th2. So the cytotoxic T cells, they actually decrease in pregnancy. So we have reduced tumor necrosis factor, reduced interleukin 2, and also we have reduced in the T helper 1 activity. So the lymphocytes, they usually remain the same. The helper cells also, they remain the same. In pregnancy, there is a immunological switchover. So thereby there is decreased T cell immunity in pregnancy, and there is increased maternal heart rate and oxygen consumption and decreased lung capacity. So we all know in pregnancy there is elevation of diaphragm. The diaphragm elevates by 4 centimeters, thereby reducing the total lung capacity of in pregnancy by 5%. So you will have reduction in the functional residual capacity and the residual volume in pregnancy, it will reduce. So there is decreased lung capacity already in pregnancy, and when there is any pulmonary infections like swine flu, influenza which occurs in pregnancy, thereby it creates more morbidity and mortality to the mother. So all these things, you see hypovolemia, low hematocrit, increased heart rate, vasodilation, low BP. All these are physiological changes as such in pregnancy, which can also occur in pathological stages during fever also. There might be increased blood flow, there might be tachycardia, there might be hypotension. So we will not be able to categorize the severity because certain things can mimic a normal physiological phenomenon in pregnancy like low BP, which usually occurs in pregnancy, and also the increased heart rate and the hypovolemia stage. So all these features makes it difficult to diagnose the severity of infection in pregnancy. So what determines the severity of infection? So how severe is the infection? Usually it depends upon number 1, the duration of fever, number 2 will be the gestational age, and number 3 will be the maximum temperature reached. For example, in infections like dengue, the temperature can go up to above more than 40 degrees Celsius. So all these 3 factors determines the severity of infection in case of in pregnancy. So now a short information about sepsis. Sepsis may be defined as infection plus systemic manifestation of infection. Septic shock is defined as persistence of hypoperfusion despite adequate fluid replacement.